Hello everyone and welcome back to my channel. In this video, I will teach you 12 coronavirus terms you need to know for better COVID-19 awareness. As coronavirus spreads across the world, we have been news with COVID-19 news. However, at times, some of the terms being used can be confusing. Understanding these terms will help us understand which precautions to take better and stay safe. I'll keep updating the list with new coronavirus terms as I come across them. So without any further delay, let's look into the video. First, virus. A virus is an agent of infection that can replicate itself only inside the cells of its living host body such as plants and animals, but mainly bacteria. They cannot survive for long on non-living surfaces. Thus, the coronavirus or COVID-19 cannot survive on non-living surfaces. It can only pass from one human to another while talking, coughing, sneezing or exhaling. Next, we have symptom. A symptom is the sign of a disease or disorder. The primary coronavirus symptoms are fever, dry cough, breathing difficulty, and fatigue. The third term is CDC. CDC stands for US-based federal agency, Centers for Disease Control and Prevention, which protects America from health, safety, and security threats. And fourth, we have WHO. WHO is short for World Health Organization. It is a United Nations health agency which is based in Geneva, Switzerland. The World Health Organization is a specialized agency of the United Nations responsible for international public health. The WHO Constitution states its main objective as the attainment by all peoples of the highest possible level of health. Next, we have communicable. Anything easily spread or transmitted is communicable. COVID-19 is a communicable disease. A communicable disease is one that is spread from one person to another through a variety of ways that include contact with blood and bodily fluids, breathing in an airborne virus, or by being bitten by an insect. Reporting of cases of communicable disease is important in the planning and evaluation of disease prevention and control programs, in the assurance of appropriate medical therapy, and in the detection of common source outbreaks. Next, we have incubation period. The incubation period is the time that a virus takes to become noticeable in the human body via symptoms. It is the time period between the infection time and the symptom appearance of a disease. Then seventh, we have screening. Screening is the method used to check if a person is showing any symptoms of a certain disease. This involves taking the person's temperature, asking questions to understand if any symptoms are showing up, and if the person has been in contact with others who are infected. Next, we have asymptomatic. When a person is showing no symptoms of a disease, he or she is asymptomatic. Please note that an asymptomatic person might also be infected with COVID-19 as it takes time for the symptoms to appear. Next, we have social distancing. In public health, social distancing, also called physical distancing, is a set of non-pharmaceutical interventions or measures intended to prevent the spread of a contagious disease by maintaining a physical distance between people and reducing the number of times people come into close contact with each other. Social distancing is not the same as quarantine. It refers to these measures taken to reduce social interaction among people. This is being done now in view of the coronavirus epidemic to check the spread of a disease. Next, we have flatten the curve. To flatten the curve means to slow down the spread of a communicable disease like COVID-19 so that the healthcare systems can catch up in trying to manage it. The curve represents the number of coronavirus cases over time. If there are a large number of cases in a short time period, the curve will be steep. Then we have mitigation. Mitigation refers to the measures taken to slow the spread of any disease or infection. To check the spread of coronavirus, various countries are taking up many forms of mitigation such as screening, quarantining, social distancing, and encouraging proper hand washing for good hygiene. Next, we have zoonotic. A disease of animals that is communicable to humans is a zoonotic disease. COVID-19 is a zoonotic disease since its source is said to be an animal. However, animals can sometimes carry harmful germs that can spread to people and cause illness. These are known as zoonotic diseases or zoonoses. Zoonotic diseases are caused by harmful germs like viruses, bacteria, parasites, and fungi. These germs can cause many different types of illness in people and animals, ranging from mild to serious illness and even death. Animals can sometimes appear healthy even when they are carrying germs that can make people sick, depending on the zoonotic disease. Zoonotic diseases are very common both in the United States and around the world. Scientists estimate that more than 6 out of every 10 known infectious diseases in people can be spread from animals, and 3 out of every 4 new or emerging infectious diseases in people come from animals. Because of this, CDC works 24/7 to protect people from zoonotic diseases in the United States and around the world. So friends, I hope you enjoyed this English video lesson and learned a lot. So you can continue studying with me by subscribing to my channel, and don't forget to press the bell icon to get the notification for my upcoming videos. Thank you for watching.